All right, let's talk about something that is so common, but also just so incredibly frustrating. I'm talking about that burning, stinging, or tearing feeling in the vulvovaginal area. It's the kind of pain that can make you feel raw and just constantly on edge, and it usually sends our brains down one very specific path. Right? The immediate thought is almost always, oh, it's thrush or a yeast infection, maybe a UTI. I mean, it just feels like an infection, doesn't it? But is that really what's going on every single time? And here's the thing. More often than you would probably guess, the answer is a hard no. That burning or tearing pain could have absolutely nothing to do with an infection at all. So let's get into why that is. So, why do we all jump to that conclusion? Why is infection the first thing that comes to mind? Well, honestly, the sensations are so similar that it's a really easy mistake to make, but it often leads to this frustrating cycle where nothing seems to work. Does this sound familiar to anyone? You've tried all the over-the-counter creams, maybe you've even gotten prescriptions from your doctor, but that burning feeling just doesn't go away. It's a question that so many of us have asked ourselves. And here is the simple, direct answer. The reason those creams and treatments aren't working? It's because you're treating the wrong problem. The pain isn't coming from some kind of bug or yeast, it's actually coming from the health and the condition of the tissue itself. Okay, and this leads to another huge fear that can creep in. When all the tests come back negative and the treatments fail, it's so easy to start wondering, is this just all in my head? Let me be completely 100% clear on this. Absolutely not. This pain is real. It has a legitimate physical, biological cause. We're talking about actual changes to your skin, to your tissues, and even to your nerves. It is not psychological. So, if it's not an infection, what on earth is actually going on down there? Let's dig into the real underlying physical causes that, believe it or not, are so often missed. So how does a doctor start to piece this puzzle together? Well, they look for clues. For an infection, the pain is often sudden. For these other issues, it's usually more gradual, something that builds over time. And a huge clue? The swab results are negative. The antifungal creams don't work. And then there's context. Did this start happening after childbirth or as you entered perimenopause? These are all major clues pointing away from infection. All right, so first up, let's talk about the most common culprit, and it's called genitourinary syndrome of menopause, or GSM. You might know it by its old name, vaginal atrophy. Basically, as estrogen levels drop, the vaginal tissues lose their plumpness, their thickness, and their stretchiness. They become so fragile that they can literally get tiny tears from friction, and that feels like burning. And just look at this number. This shows you exactly how common GSM is. It affects up to half of all postmenopausal women. So this is not some rare, unusual condition. It's a completely normal biological change that we really need to be talking about more openly. Okay, another possible cause is something called lichen sclerosis. This one is an autoimmune skin condition. That means your own immune system is mistakenly attacking the skin on the vulva. This attack makes the tissue really fragile and prone to tearing, which causes a sharp burning pain. But again, if you get a swab, it's going to come back negative for any infection. And then there's provoked vestibulodynia. Now, with this one, the tissue itself might actually look totally normal. The problem here isn't the skin. It's the nerve endings right at the entrance to the vagina. For various reasons, they've become hypersensitive and are basically on high alert, firing off pain signals at even the slightest touch. It feels like a sharp, burning sting, but it's a nerve issue, not a tissue issue. Phew. Okay, so figuring out the real cause is the giant first step. But the next question is, what can you actually do about it? Let's talk about real, effective solutions that can actually bring you relief. This is such a logical question, right? If something hurts when you touch it, your first instinct is to just stop touching it. So when it comes to these conditions, is avoiding intimacy the answer? And unfortunately, the answer is no. Just avoiding intimacy might stop the pain in that moment, but it does absolutely nothing to fix the underlying problem. Things like GSM and lichen sclerosis are often progressive, which means they can actually get worse over time without the right treatment. So being proactive is really the key. The good news is there are definitely practical things you can start doing right now. First, lubrication. And I mean generous amounts of a good quality, fragrance-free lubricant. Second, protect that delicate skin. Wash with plain, warm water only. No harsh soaps. Third, moisturize. A daily vaginal moisturizer is different from a lubricant. It helps restore hydration day to day. And finally, if you're with a partner, communicate openly about what feels okay. Now, for medical solutions, the treatment has to match the cause. For GSM, topical estrogen is the absolute gold standard. It helps restore that tissue thickness and health. For lichen sclerosus, it's often topical corticosteroids to calm down that inflammation. And for issues involving muscle tension or nerve pain like vestibulodynia, a specialist pelvic floor physiotherapist can work wonders to release tension and help desensitize those nerves. So now that you're armed with all this knowledge, you can start to move forward with confidence. This last part is all about knowing what to do next, and really importantly, knowing when you need to see a doctor right away. Okay, and this part is absolutely critical. While the conditions we've talked about are pretty common, you need to see a doctor urgently if you experience any of these red flags. That means sudden, really severe pain, any heavy or persistent bleeding that's not normal for you, ulcers or sores that just aren't healing, a fever, or any burning that's happening along with blood in your urine. These can signal something more serious that needs immediate attention. So, if we boil it all down, the most important thing for you to hear is this: your pain is real. It's not in your head. It has a physical cause that a doctor can and should diagnose. And most importantly of all, there is effective help available that can make things so much better. The whole journey really starts with understanding that infection isn't always the answer. The next step is to go find that correct diagnosis. So the final question is really for you. Your pain is real. Are you ready to find the real solution?